They continue to take it for 6 months. That's not healthy. Medicine is not food. You take it when you need it, and that's what a practitioner does. I go to my herbalist. I don't try to treat myself because I know that I'm pretty stupid. And treating myself is a pretty stupid thing to do. So I go to my herbalist. He gives me 3 days or 6 days supply. I got to go back every week. It's not like he's trying to take advantage of me. He knows that if I'm getting something and I'm changing as I go along, so he adjusts the formulation. That's the same thing I do with my patients. With cancer, you may give longer than 6 days. I may give somebody a month's supply, but then I review that and constantly change that. Because your condition changes. You give medicine, you're changing. Yeah. 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 But you're saying that you don't have to take them as supplements. Get out in the sunlight, exercise, have your room dark at night, eat lots of fish. So then you don't need supplements. Now, if you can't do those things, then yes, you can take supplements, but you take them to the degree that you need them. You know, I think that's part of our Western culture. If something is good, a lot is better. Yeah, you need to do regular blood tests to know. Yeah. 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 Yeah, absolutely. So we're talking about homocysteine levels, which are generally rise because of low levels of folic acid, B6, B12. So they may be very high, but as you take those supplements, it comes down, and then you reduce those levels, or you just find it from food. Yes. Oh, yeah. There's one of the professors, the one I was mentioning, who was working on D3, and he drew a circle, a map of the U.S. You know, there's Florida there. There's Lake Superior. And he said, this is it. Cancer level low, cancer level high, vitamin D level low, D level high. He said there is an absolute parallel. Same in Europe. Cancer is high in Sweden, low in Italy. Just simply exposure to D3, sunlight. So yes, absolutely. And he recommends 10 to 15,000 IU a day. But again, you need to test because it's toxic. Vitamin E is toxic. Mm-hmm. Right. Yeah. Right. Yeah. Right. 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 No. Yeah. 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 Mm-hmm. Yeah. Mhm. D3, yeah. Yeah. Okay. Yep, that makes sense. I mean, it is the balance of those sort of things. But I still, although I haven't seen that report, I do believe that any supplement in excess can produce toxicity. But you need the balance. For example, we're talking about melatonin. Melatonin doesn't work unless you're getting adequate levels of T helper 1. And so often I give astragalus with melatonin because astragalus stimulates T helper cells. Any other questions? Yeah. Vaguely remember the name from the 60s or 70s. No, no. Again, there's a lot of people who've written books, but again, I come back to the fact that we're entering into an age of integrative medicine, and that what we need to be able to provide as complementary health practitioners is evidence of efficacy. And I just gave a few examples there, and many more are in my book, and many more in the next book. And that's really what I think is important. Evidence isn't everything, but it does give you an entrance into the integration that I think is really critical. And oncologists are not going to listen to us unless we bring some degree of evidence of what we're doing. Yeah. Well, double blinds are great. They're not the only kind of evidence, but certainly they are. Yeah, but they're the best evidence, but not everybody can afford them. Anyway, I want to thank you for coming this evening, and I hope that you take away something of use from the evening. And it's nice to be back in South Africa again.